this is the beginning, right? So this could be something that, years from now could be practice changing, right? If we find that we're able to deliver radiation in this way, potentially we can revolutionize how we're treating patients. If we can, it might allow us to deliver higher doses with less side effects. Perhaps we give the same doses, but we have very minimal to no side effects. I think one thing that we're all interested in too is some of these diseases where we've really not made that much progress or very modest progress. Like if we think of things like pancreatic cancer, where radiation is always these days limited by how much you can give by the side effects and what normal organs are around. So when you have something in the abdomen, there's a lot of sensitive organs around there where you really can't give that high of a dose. Is that why we don't really have that much of a role in pancreatic cancer, or why, it may be, perhaps, we can deliver it using flash radiation and then we have minimal to no side effects, but able to give that dose that we need to get rid of the cancer. Or another area of our interest too is what about the immune response? So when flash is delivered so fast, the treatment is delivered in milliseconds. So, there's a lot of things that happen on the cellular level and chemical level very, 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 very quickly, and as radiation is traveling through the cell of the patient. So some of these chemical steps and biologic steps don't have time to happen when flash. So we're learning what this flash effect, how it happens. But presumably there's also some things going on with the immune system. If we're skipping that step or maybe missing a step, or something is happening that normally doesn't, what happens there? Can we use immunotherapy? Does that help? Will immunotherapy help in that case? Can we combine the two? That would certainly, after we assess the safety of everything, that's something that we can be looking at, so that would be a bit down the road, but certainly an area we're thinking of. Another thing too could be, certain pediatric diseases like diffuse pontine glioma, DIPG, that has a terrible, 5-year survival, for patients and kids. So, a lot of times radiation is really the main treatment we have because of it's in the brainstem. We can't really take it out surgically, but these kids recur time and time and again, and it's also in a sensitive area. The brainstem and the brain are right there. So what if potentially flash has a role there? Maybe we can be helping these kids either by delivering more dose safer. I think there's a lot of different ways that we can think about it, and a lot of different ways that it can go. The potential of it, I think, is vast. We just gotta slowly start at the beginning and incrementally figure out, how it goes in humans. And so this was the first clinical trial of it. So we'll see.